You think you know me.
Great. Hey guys, what's going on? Doing a little bit of a different way of this video today. I'm actually doing this on a laptop, a new laptop that I got for my own personal use. So I've been overdue for a computer probably for over 10 years now. So it was pretty much the time to do it. So as you guys have seen with my journey with my neck has been pretty interesting. It all kind of started, well, it did start a while ago. You can go back on my videos to see when it started, but you will see that most of it actually, let me just see if I can adjust this anyway. No, that's all right, it's okay. Most of it actually started, worsening probably in 2019, 2020, went through some moves, did some things. Eventually got myself into surgery, 2-level fusion, ACDF C5-C7. So 2 levels of my disc are fused up because the spinal cord compression was so severe. And you've seen my before pre-op, after the operation, or 3 days after the operation, then a couple weeks afterwards, and a couple months afterwards, and 6 months down the line. What I can tell you is that from the fusion in itself, they gave me 50% better on that, and I really think that that's gone to about maybe 75% better from that, if not a little bit more. The problem is that I'm still having lots of problems up here, right up here. And that's ironic because when you looked at my MRI, you saw that I had issues from C5-C7. I had a good disc of C4-5. So if you don't know what a cervical spine looks like, go ahead and look it up somewhere. I'm not going to put any imaging on there. And C3-4 is bad, and it's really, really a bad herniated disc with a little bit of spinal cord compression, as well as the the disc is very, very crushed and compressed. So I asked the surgeon that did my surgery, what would you do in this case? Because of the fact that he did the surgery, and he says, I wouldn't do anything except extend your fusion 2 levels. Now, I got another opinion on that basically told me that, he would put an artificial disc at C3-4, and he gave me, he said that it was pretty much the right way to go approach it. It's an orthopedic surgeon. So I had two conflicting opinions. Now, the orthopedic surgeon that I talked to was well out of state, didn't know my neurosurgeon at all, only had my history of what I presented to him, and gave his opinion on that, basically saying, I don't see why you would have to go through a 4-level fusion to fix the 1 level. So naturally, I decided, let me go to another doctor in the area, look up the artificial disc replacement stuff, and see what he says, see who supports it in the area, and see what that doctor says. So I found one in the area, ironically enough, close to where my neurosurgeon is anyway. He's not really dealt with my neurosurgeon, but he's maybe run into him from time to time. So I had an appointment about a couple of weeks ago to say, hey, I need a third opinion, because one's telling me extend the fusion, the other one's telling me artificial disc replacement. Before all this was starting to break down anyway. I begged the neurosurgeon to take care of the C3-4 as well with an artificial disc replacement. He gave me answers such as, like, it's not approved by the FDA. Then he said it'll be a hard time to go through insurance. Then he said because of the way your x-ray shows and the reversal of the lordosis a little bit, you might have a harder time, so I don't see any room for an artificial disc. I told him all this, and he's like, okay, well, let's take a look, let's see. So I had my first appointment with this doctor. I felt a very good comfort level with this guy right away, almost. So that's a good thing. That's a positive, right? So I had a baby a couple weeks ago, and he went through this, and he says, well, the good news is your fusion looks awesome. He goes, the surgeon that did this fusion, he did such a fabulous job. This is really like the best you can ask for. He goes, and this is amazing. This is an amazing job. He goes, you should have no problems from this whatsoever. This is great. Keep on the path that you're doing. However, what I do see is that I see your C3-4 has a major disc herniation, and it's got some good foraminal stenosis, which means the nerves are all crushed and compressed in there, as well as spinal cord compression a little bit happening. He says flattening of the spinal cord, but it's really it's not compressed. He says it's flattening, but it's really bothering it a little bit more. So he came back and he said now he was honest with me. He was just honest with me. He came back and he basically told me, okay, here's the thing. Now, the problem that I'm having with this is I'm on the fence about what to do. Because this is a very difficult situation. Of course, having a difficult situation is no big surprise to me. It's just the way my life goes. I typically have a decent life, but things are sometimes made a little bit difficult for me to try to figure these things out. So he came back and he says, this is a little bit more difficult situation because if it was just the adjacent level at 4 or 5, I would tell you go ahead and fuse it up. He goes, or if you had a problem with 4, 5, and 3, 4, I would say, yeah, let's extend the fusion to 2 levels. He goes, I would have absolutely no problems telling you that. However, because that's not the case, I cannot, and this is what every other surgeon has said, I cannot fuse just 3, 4. Even a surgeon that I had, I cannot fuse just 3, 4, C3, C4, because if I did that, your 4, 5 would just go, have like this and just get crushed like that. He goes, and that would just be horrendous for you. He goes, that would just be, at that point, you would just might as well just do the 4-level fusion. He goes, but the problem is, I don't want to fuse 4, 5. So, you have 3, 4, you have the 3, 4 over here, and you have 4, 5 over here, and a 5, 6, which is all fused up like that. I don't want to fuse the 4, 5 to get to fuse a 3, 4 because your 4, 5 is really good. He goes, I don't want to fuse a good disc. He goes, that's the problem that I'm having, trying to understand what approach I would take here. He goes, now you're having pain, you're having weakness, so some weakness symptoms, all on your right side, by the way, which ironically enough here is where I'm feeling it. So weakness, pain, symptoms, stuff like that, all on the right side. So ironically, that's what he's showing, and I'm saying, okay, that's what he's showing me. The MRI, everything's on the right side. Ironically, that's where everything's bothering me is on the right side. I'm also having some weird jaw issue where my jaw feels kind of disconnected too. I don't know. That'd probably have to be the next thing I have to take care of. And I know I've been overdue for the teeth thing, but he says, so what's the next option at that point? Honestly, he goes, given your age, now if you were older, if you were like 30 years older, I wouldn't be throwing this out there for you. But given your age, in your early 40s at this point, which is still fairly young, and the thing that I would throw into you is an artificial disc replacement at C3-4. So 2 out of 3 surgeons are telling me artificial disc replacement. Before I had my surgery, I had 2 other surgeons. Two other surgeons. I had 2 other surgeons that told me that you probably could use an artificial disc replacement at 3-4, but you can chance it without it. What's probably going to happen is if you chance it without it, the worst case scenario is that it will break down even more after the ACDF, and then you're just going to be going back for the second operation. They were right. So I had my first surgeon listen to me, I probably wouldn't be making this video. I probably would be good and set, and that's it. So, he threw the option out there. He goes, now, it's really up to you. This is definitely elective. C3-4 artificial disc replacement, it's still kind of considered experimental, but, it's really had great success rates for a lot of patients. And, it's what I would use. I don't really offer it for a lot of patients. He goes, the only concern that I have is that these are degenerative changes that are occurring in your neck. And over time, you could experience more pain from this. But the goal is to get you pain-free from this. So he goes, I don't know. As a matter of fact, I'm even feeling it right here. I'm just feeling it right here. So, and he was honest, and he says it wouldn't be surprised if the disc is really compressed, if it's fragmented, that could also be a problem. but I would still go with the artificial disc replacement. So, I had a nice appointment with this guy about 2, 3 weeks ago, and it worked out great. It gave me the answer that I was looking for, answer I was hoping he was going to give me. Granted, if he would have said the only way I'd go was through a extended fusion to fix this up because of things, then I would have been, back with my other surgeon to do this after August. Now, uh, I decided that this was a good enough answer. I felt comfortable enough. He did ask me some questions like, why did your surgeon want to extend the fusion? What did he say? I told him because of the reversal of the lordosis a little bit, he just felt that would be more necessary. He says, well, he goes, yes and no. He goes, he goes, that's a tough decision to make. He goes, but so he goes, what is the other, why didn't he want to do artificial disc to begin with? So I gave him the answers on that, and he says, okay, I can understand that. Then, of course, he asked the question, why did he want to wait 12 months until the 12-month mark to do a second surgery? What is the deal with that? And I said, well, because it's a fusion, he wants to extend the fusion. It sounds like he wants to wait till it's fully healed. And he said, he goes, okay. He goes, that makes sense. He goes, I was hoping that's what the answer was you were going to give me was. And basically, he just came back and said that that was probably the answer that he would give too if it was an extended fusion, is to wait at the 12-month mark for fully healed, because at that point you don't know if your bones are still healed or not. You don't know if your fusion has completed at that point. And if you do a surgery earlier, you're going to have a lesser chance to fuse. But he said he looked at my MRI, he looked at my X-ray. He goes, from everything that I see, at this point, you're almost fully fused. If not, because you can't always tell on these MRIs. You can't tell, but you can definitely tell a little bit more on the X-rays. But from what I'm seeing, that's what it seems to be. So it looks like you're almost fully healed anyway. He goes, but I would honestly, if I was him too, I would say wait till that 12-month mark, restart that process if it was an extended fusion, and go from there. Okay, good news. So he agreed with him on that. What he didn't agree with him was the approach about extending the fusion, and that's another surgeon said that, and beforehand, 2 other surgeons said that too. So now, we're talking 4 out of 5 surgeons who say, before and after my surgery that I had, we're recommending artificial disc replacement. So I went out of there and I said, let me see. Let's, I got to think about this. And I thought about it. And, he said, I asked him because, before I left, I asked him, I said, when could I get this done? Do I have to wait the 12-month mark to get this C3-4 disc replacement done? Or is this going to happen, at any time, at any point? He said, honestly, you can go outside right now, schedule to have it be done in 2 weeks, and you'll be set and ready to go. He goes, you can do this right now if you want. So I went home and thought about it, and I called him up and scheduled after about a week, I called him up and scheduled the surgery for May, which was kind of what I was targeting originally. In my own head, after this surgery that I had, I knew my body just told me that this was needed. My body told me that this was needed. My mind has said that after this surgery, I am going to be perfectly fine, back to some form of normalcy. For anyone that's wondering what symptoms I'm having, like I said, weakness on the right side, more or less, legs and arms, probably up to about here on my arms. As well, I could feel like it's kind of like my head just kind of feels like a little bit more like that. So something's kind of crunched up in there, and I could hear it crunched up in there as well. And it's not arthritis crunched up. It sounds like the disc is just being completely destroyed in there. So when I drive, I'm not getting too much numbness and tingling when I drive as much as I used to. But the problem is that this is drive, and then up here it's just crushed, and it's like, and if I stand at a traffic light, it's almost impossible. Or if and the problem is, like, I've gone, it's much better than last year. I can tell you that much for certain. Last year, if I were to drive, there were points where I couldn't even drive down the road without feeling very off. I don't want to call it a dizzy feeling, because it's not a dizzy feeling. It was very off. I felt very off balance. As a matter of fact, last year my entire body was weak from this, and I got very sick. And that's what drove me to surgery. This time my entire body is not weak. It's just part of my body. It happens to be the part that has a problem here. And now when I drive, it's not. I do get the off balance feeling. I actually got it last week when I was driving, and it was only like it wasn't down the road, but it was kind of like this store, maybe about a mile and a half away, and I felt very off balance to the point where like it was all on this side, and then like suddenly I was driving into, because I was trying to control myself, I was driving into the lane that was next to me, and I was like, whoa! I'm like, and I wasn't dizzy, but it was just like a very off balance, off feeling, and it's not correct. So when it's correct, right? So by the way, here's my scar. Anyone wondering, here's my scar from my ACDF. So you can barely tell I have it. So I went today for another appointment because I wanted to get more questions answered. So what are those questions that I had? That's a very good question. And I'm going to go over those questions because I got them all answered, and my comfort level went from kind of like, let's just say the bar was all the way up here, right? Let's say the bar was all the way up here. My comfort level was about here with this guy, enough to schedule the surgery. After talking to his PA and talking to him, my comfort level is about right up here right now. So that's, and I'm not going to say it's all the way at the top, it's about right up here. Because there's a couple things that I'm just still a little concerned about. But naturally, those I'll have to address. So let's get on to the questions that I asked this guy, because there's a lot. So let's ask that first question. What artificial disc is being used? He has, well, she has, his PA is a female. She answered a lot of the questions for him first before I talked to him. Then I talked to him for 5 minutes. He answered and went over a little bit more. So what artificial disc is being used? They did confirm it's mobi-c. I know that that can become a very challenging thing with mobi-c. I'll get to that in a minute. I asked him how many of these he does a year. He says anywhere from about a dozen to 20 a year. He says a reason for that is because he takes a more conservative approach with the ACDF surgeries when he does them, and when he does neck surgeries, because that's just more common. And if you were to say how many ACDF surgeries, neck fusion surgeries he would do, he'd say over 100 a year with his success rate over 90%, close to 100% at that point. I don't actually. He didn't even say over 90%. He just said 100. He just said close to 100%. And then, so that just might mean like 1 or 2 patients out of 100 maybe had a major problem or small problem. But so I asked him about that, and he says, yeah. He goes, I have that. What is your experience with an artificial disc replacement in the upper cervical? Has he done it at C3-4? He says he has, and it's gone very, very well for the patients. He says, as a matter of fact, so well for the patients that he does artificial disc replacements for, that he's never had a patient get out of surgery saying they had more pain. They've always had less pain. He guaranteed me probably, well, he didn't guarantee. He says nothing's ever guaranteed, but he says if I'm going to suspect anything, your pain level will be 75% less reduced compared to what it is now. So that's a good thing. He says that people that have had artificial disc replacements, he doesn't offer them to everyone, and there are special cases like mine where he will offer them. He did tell me that if this was an adjacent level or 2 adjacent levels, he would not even be offering this to me. He would come back with the extended fusion at that point, because that would be the way to go. But for this is a different case, and he feels that this is the right move as far as he's concerned and I'm concerned. So he did say that people come back and come back and he's never had anyone report a major problem with an artificial disc. The people that he's done surgery, he says here's how many people come back where I've had to revise the artificial disc or something went wrong with it in my entire career. Zero. That's good. That's actually really good. So that's why my comfort level went up even more with this guy. And he says, I've never had a problem. He says it's such a standard procedure for him that it just goes. So I did ask him if they had an artificial disc they could show me so I can see what it looks and feels like. They did not have anything. He says, unfortunately, the one that they lost because it was so small that he lost it and he couldn't have it. I'll see if maybe next time I get there. Of course, I asked him if there was a success rate. He basically said what I told you there, and that's basically 100% success rate. Um, I did ask him if there's certain levels for every size. His PA says that basically this is one thing that I kind of didn't like the answer to this. She says it's a trial size, but what that means is not. It doesn't mean she's giving me a trial disc or anything like that. It doesn't. I don't. She just said a trial size, which means probably with the size that they used during a trial. Um, of these discs. But it doesn't sound like she said that basically the disc will be will basically be fitted for the certain heights and everything like that. Um, he says I'll keep going on this. Will I be in a neck brace? And if so, what kind? Am I being fitted for it? They said typically for one level they will not send anyone home with a neck brace. But if they do give me one, it will be a soft collar and for my own comfort. So use it at my own discretion. Um, so that's good to know. Do I consider this? Did they consider this minimally invasive microscopic surgery? And they said no. However, the incision will be small, so I would not even know. So they just, it would be up here. It'd actually be on the left side, so it would be up here. I asked them why on the left side and not the right side, and the answer that I got was tradition. Uh, Apparently, orthopedic surgeons, which is what this guy is, typically do the incisions on the left side. The neurosurgeons typically do the incisions on the right side. The right side is actually more difficult to deal with because there is some sort of nerve on there that can get hit, and it causes damage and is harder to heal from. As well as there might be more of a risk to vocal cords on the right side as well. So orthopedic surgeons will do it on the left side just because of tradition. Sometimes he'll say he'll do it from the right side, especially if there was vocal cord damage, then he would take it from there. But he says that because I did not have any vocal cord damage, already from here, from the first surgery, he doesn't think that I'll have vocal cord damage or any sort of major issue coming in from on this side. He thinks it'll just be as easier, if not easier. Which is great. I'm glad he told me that because again, there's no guarantees. I could lose my voice. I could have swallowing problems. Those are the things that could potentially happen. I didn't have that with the ACDF. I minimized everything by drinking lots of ice water when I was in the hospital, almost all day, all night into the next morning. Having ice pops a lot at home for maybe about a week or two. And even after a couple of days, I was fine. Like I think maybe the thing with the throat and not being able to swallow is more of a swelling thing, from my understanding. So for me, I really reduce the swelling by making the right moves for myself, and I'll probably try to remember that for this one. I asked them what are my limitations post-op and for how long. Try not to bend, lift anything heavy for a few weeks. Use it at my own discretion. As I'm starting to feel better, obviously increase a little bit more. There was no actual pound limitation or anything like that. Just be smart about it is basically what he told me, which is good. Or she told me, actually. She told me. The PA told me. So there's no real limitations. I could drive. Apparently, I'll be able to drive after 2 weeks. They say 2 weeks is the minimum you should wait, as long as you're comfort, as long as you're not on a lot of pain medications and stuff like that. Okay, good to know. Will there be any neuromonitoring being done during the surgery? Yes, thank you. That made me feel so much more comfortable. A lot of orthopedic surgeons will not offer neuromonitoring because they are not neurosurgeons. And when you're dealing with the neck and all that, you really want to have neuromonitoring because if something goes wrong with the nerves, they're going to be able to catch that right away and fix it. That's a good thing. I think that's a good thing. Who else will be doing the surgery with the surgeon? Him, his PA, the neuromonitor, the anesthesiologist, obviously. And then sometimes they say, it might be a surgeon, another surgeon that might be available, or a surgeon to just assist them for that, or maybe a surgeon that's in training just to see how it's done might be there as well. He goes, that could possibly be. So that's good to note that. How many post-op appointments will there be and for how long? He wants to see me at the 2-week mark. He'll probably check up on me the night of or the day after. Just give me a quick call. Um, is what he told me, which is a lot more than what the previous surgeon did, because he didn't even release me in the hospital. Uh, he sent his PA to release me, but it doesn't matter who releases me as long as one does. So 2 week, 6 week, uh, th- uh, probably 3 month, and then after that, maybe a couple more times after that, just to see how I'm doing. Up to me, up to him. We can discuss that after the 3 month mark, but typically no longer than 6 months. So typically, same thing that I just went through. Same steps here. Okay, well, so that keeps that's good to know, because it gives me a plan at least. Okay, so what happens if the artificial disc should fail, and what would be the next step? If the artificial disc should fail, which he's told me he's had zero failures and zero complications and zero people coming back for any revisions, but what happens if it fails? You know, what is the next step at that point? The next step at that point is an extended fusion, no matter what. So his PA said that, and he said the same thing. So that is to note that option is on the table should this not work. It is my last fallback at that point. Extending 4 levels is a little bit more difficult than going through this. This recovery should be much easier. In about that in a moment. Will I eventually be able to get back to playing any sports or ice hockey? He said try to stay to non-contact sports. Ice hockey, if it's a non-contact ice hockey league, yeah, you could probably go back to playing it. You had the fusion, you had the artificial disc. Typically, when you start talking about 2-level fusions, it's about going back. With the artificial disc, it's still about going back. The problem is emotions. You got to be careful because, look, with anything, they can come loose or something can happen, and if you get knocked around, then that will be a big problem too. So try to avoid that. I'm up in the air about that. I don't know. I'll have to see. Hopefully not. But accidents happen, right? And that can happen too. An accident can happen too. I can get into an accident and it can completely knock it loose. They try to avoid that though, but this is a little bit different because it's not offering the same stability. But if it was an extended fusion, sports are completely out. Completely out of play at that point. There's no return to any sport at that point. Because once you start getting 3 levels or more for any sport like football or baseball or anything, they tell those athletes, forget it, you're done. So I'm kind of on the fence about whether or not I return back to playing ice hockey or not. If I feel 100% better, and back to the way my normal. See right now, you can see I'm doing this. Look at that. See, it's all up here, so I can tell you right now. And if I push in here like this, boom, strength just comes right back. So I know there's a problem. So there is that chance. There is that chance that I can come back and play a sport, or there's that chance that I might just say, I'm feeling so well, I don't want a chance having a big major problem. Let me go ahead and just quit sports for a while and see how I feel a year or two from now and see what happens. Granted, that's up to me. They did suggest walking almost immediately would probably be the best thing to do, and I think that's probably the best thing to do. Okay, so as you saw, I had a reversal of the neck curve with the lordosis. You can look at that on previous videos of my X-ray, especially in my previous one. You can see the reverse side by side, I believe, on a preview. You can see how it's kind of like, if you have a neck, it kind of goes like this. Mine was kind of like this, and then lordosis started happening like this. So all above the fuse. So it was, your neck goes like this, your bends back. Mine kind of went like a little bit further up, which was, the reversal of it, and then after this fusion, it was kind of like a little more straight, even a little bit more forward like that. So that's my neck trying to make up for the fusion and any pain that's occurring up here as well. So the goal of the artificial disc is to try to reduce or get rid of that pain, so I'm not doing that. Granted, I will have to position myself better and make sure everything's good, but again, it happens. Would you suggest any PT at any point post-op, and at what point? They typically do not send any of their patients to PT. It really is up to the patient. So it will be up to me at what point if I go to PT. Maybe I go 6 weeks. Maybe I don't. Maybe I don't go PT. What I will be doing between now and my surgery in May is I'm going to be doing my own PT at home. Hopefully, maybe I can lose a few pounds in the process because I sure as heck need to. Because if you look at me last year, I was not this heavy and this, I basically gained 40 pounds since then. So I need to lose at least at the very minimal, at least 10 at least. My goal is to say maybe 25 by October, which would be amazing. Okay. So I'll try to do my own PT at home with a couple neck stretches because maybe something happens. Maybe a miracle does occur. Maybe I do get out of this. Maybe I don't need surgery. And he says that's okay too. He goes, if that happens, that's okay. It does happen to our patients from time to time where they call the, surgical coordinator. And when they call the surgical coordinator, they say, I'm feeling great. I'm feeling awesome. I don't need the surgery and that's it. So that's that. Okay, so how are they addressing the pain in the hospital after the operation? Medications as normal. When I did an ACDF, I refuse all medications. They will not give morphine. They will give medications and IV fluid. So I had, when I was in that recovery room, they're like, yeah, you're doing well enough. They're not, that you're doing well enough. Oh, here's some pain meds. Here's some pain meds. And I was like, I'm not in pain. I don't want it. I'm like, I don't want the pain meds. It's just I'm not in extreme pain. Now, if it's extreme pain, then yes, I think the pain meds will probably be necessary, which will be oxycodone and muscle relaxers and the nerve stuff and all that stuff. But more than likely not. Do I need to donate my own blood before surgery? No. But there, if there does become any kind of blood loss of any sort, blood transfusion could be possible. So they test you for your blood types and all that stuff. I don't even know what my blood type is, to be honest with you. I never had it tested, so that'll be part of my test when I go for a pre-op appointment. They'll take a complete blood count, blood test, and so on and so on. What happens if you go in there and things look worse at the MRI? For example, the disc is fragmented and compressed, or there's major arthritis. What happens then? Does he change the plan on the fly for an extended fusion, or what happens? He told me basically we have backup plans if we have to. Looking at what you have on here, if it's just a fragmented compressed disc that's coming out, that artificial disc going in, it's adding more disc height again. So you'll be better there, and once you're better on that disc height, you'll be good to go. And then, it's just a little bit higher, so the cup will probably be around up here. So somewhere up here. He'll say somewhere up. He pointed about somewhere up here. So the cup will be higher, and it'll be a little bit difficult to maintain because of my structure, I think, with the bandages and whatnot. But I think it should be okay. And if he gets the right spot, he probably won't even, have to worry. Hopefully, he doesn't cut into any muscles or anything because there's a lot of muscle there. But yeah, was there a lot of muscle here? Oh, there's more muscle here. Wow, there's definitely more muscle here. Oh wow, there's even a vocal cord over here, the esophagus. Okay, so yeah, so this guy did a great job here. So he has the same, so it's the same thing there. So he says, to get in a little art, if it's a fragmented compressed disc, it stays the same. The plan stays the same. If it's major arthritis, the plan stays the same. The only way the plan changes is if they get in there and the artificial disc does not fit for some reason, and then that changes, and then they have to consider what the next option is, which would probably be an extended. Or he said he would put a cage in there with the fusion at that point in time. Now, granted, they don't want to do that. But probably without a plate, so that would probably be a little bit different. They don't want to do that. That's what they would hope to avoid. He looked at my MRI. He looked at my X-ray. He goes, honestly, I don't see why an artificial disc probably won't fit in here. He goes, just looking at everything, it looks like this should fit no problem, and it'll add some disc height to you, and you should be on your way. Okay. Do I need to miss any time at work, especially if I work from home? My plan is to miss 2 weeks of worth of work. That's the plan now. However, that can change. Now, for me, I say that can change. It means I may not have to miss 2 weeks. They did say that some people return after one. The healing process of this is actually less than the ACDF. So your ACDF healing process is 6 to 12 months. This is probably about 3 months in the full healing process. That's why people almost feel immediate results and go back to work about a week later, especially with one level. So I'm hoping that I can return a week later without any major issues. The fact that I work from home all the time really does help out tremendously, and I think that's where I'm going there. However, I just scheduled 2 weeks, and I'm that's okay, and there's nothing wrong with doing that. I think maybe I will take advantage of it. Do the bone spurs or the osteophytes get addressed while in there? And he says, yes, if there's anything in the front, blah blah blah, there won't be any. We'll take care of that. We'll clean it out. We won't clean out anything in the back. They did say one of the concerns is about the facet joints being potentially worn out. Hence why if they had that, that could also change a little bit of a plan with the artificial disc. But he looked at my X-ray. He goes, your facet joints look really good. Actually, they look good enough to continue on with this. If I wanted to cancel, was there a penalty of any sort if I say feel better or something like that happens? No, there's no penalty on there. Okay, so that's good to note that. So I can cancel even the day before or day of if something comes up, something personal comes up. Granted, unless I feel 100% better through some physical therapy at home, more than likely not going to happen. I clench my jaw when I sleep. Same question I asked: is this something that gets addressed, or will this be during the operation? During the operation, they said no because they're already putting kind of something in there to keep your mouth open, and yeah, you get your mouth open in there, and then they put something in there, and they stick a tube down your throat, which is again why some people experience throat problems as well. That's that. But so they won't have to deal with that. Are the stitches being used self-dissolve, or would it be stitches that need to be pulled out? Self-dissolvable stitches with adhesive and all this stuff on there, right? Did they say adhesive? I don't think they actually. Maybe not adhesive. I don't know what they said. They didn't. I asked about glue, and they said there's no glue. They don't want the glue just in case there is a problem. They will put if I'm having a problem and they see any drainage coming from me, they'll put while in the recovery, they'll put the drain in me, but there probably won't be a drain in me more than when I am in the recovery. It'll probably just be, and that's it. Because I didn't really bleed or ooze that much from there. So that's good. Formal stenosis, there is formal stenosis, is pretty moderate to severe up there. Does that get addressed? He said, yes, absolutely. He goes in there, he cleans it out, and that's huge. I think that's huge. That's actually what a neurosurgeon does. And sorry, just had a tickle in my throat. That's what a neurosurgeon does, and yeah, that's huge for an orthopedic surgeon. I'm so happy that he said that. Of course, my big concern was, will I have too much mobility, and will it be too much for me, or will my neck feel more stable and not loose? The goal is to try to stabilize it a little bit, but it's not like extremely stable. So I will have the same mobility I have now, just with less pain, because that's what the goal is. Of course, my concern is that, suddenly I'm gonna have on top of ACDF and my neck's moving too much. They don't think it's gonna happen. They think that it's just gonna be more stable, and I'll be able to move my neck just as much, maybe a little bit more, but to a point where I don't have pain enough for that. There won't be any pain because the herniation is gone. Does it decompress the levels being affected by the, so yes, it will add a little disc height. My concern was, does it add strain or stress to the adjacent levels? The answer I got was a little about that one. It sounds like the answer was not as much as an ACDF would do if you had it there, or an extended ACDF. So it sounds like it might, but because there's movement, that will make up for it. And that's what the goal is here, so just to get out of pain, right? Or to get rid of the actual damaged disc in there. Will I get tested to make sure I'm not allergic to any of the material? This is the one that I didn't like the answer to. And the answer was no. I'm not allergic to anything that I'm aware of at the moment, but if I am, at least nothing that was put in me recently, but if I am, what happens? What happens if I start having an allergic reaction or an infection or something, right? And I'm a little disappointed about that one, and I'm wondering if I can get that test on my own somehow, just to see what material is being used. I'm gonna find out from basically a Facebook group and see what they say. Pre-op testing takes place in the hospital, usually about a couple weeks before the surgery. I've already got my pre-op sheet. Hospital's supposed to call me. It's still over a month from now, so well over a month from now, actually. The hospital is supposed to call me. If I don't hear from them in 2 weeks, call them up and then schedule just to make sure that it happens. So I'll probably look for it 2 or 3 weeks. About 2 or 3 weeks. Just look for it then and just schedule something just to make sure I'm on there. Okay, how long was the actual procedure take place? Hour to an hour and a half is what they said. They said the good news is, they don't have to deal with the plate and the screws and everything like that, so it goes a little bit quicker than the normal procedures that they do. So it's just like boom, 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 you're in and out, and that's it. So that's quick. How long will actual I answer that? If insurance denies the procedure, what is the appeal process, and will that delay the surgery for how long? Could it potentially delay the surgery? Yes, more than likely not. The appeal process is that they will take care of the appeal process and appeal the surgery for me. So just to make sure I get on the right path there, especially if I had pain and I've gone through all the steps that I need to get through. So far, so good. I haven't heard any denials from my insurance company, but again, they may not have submitted it yet. Will this surgery put my current ACDF at risk and loosen up anything inside? So that was my concern, if the ACDF that I have will get damaged or loosen anything up or anything get done. They said no, because of the fact that they're not even going in that way. They're going in the opposite way, and they're going in the opposite way and a little higher. So they're not going to even look or touch that ACDF, and there's no risk in that. So that's good. That's good to know that. Reducing swelling in the hospital. I think I talked about the ice water, ice pops, whatever. I talked about the same incision. We'll go to the same incision. They said no, it'll be a new incision. It'll be higher. I asked about, could I potentially be discharged from the hospital earlier the same day if I'm feeling well enough. They said yes, absolutely. If that's the case, we will send you home after a few hours and you'll be on your way to go, especially if you feel that you could just go home. That's because it's only one level that they're dealing with. The only reason why they're sending me to the hospital, there's two reasons. They said the first reason is because it's the upper cervical. It's C3-4, so they want to make sure it goes proper, right? That's the first thing. So when you get a little higher, you're dealing with the upper cervical, which could deal with some neurological things. And it sounds like to me the neuromonitoring is done at a hospital and not done, at the surgical center that they typically use, because I could have been getting that surgery done at their surgery center over there. The other reason is because I have a recent ACDF surgery for 2 levels, and they want to make sure that there's less risk of infection or anything like that, and just to make sure that I'm okay. But if I'm okay after a few hours in the hospital, they'll send me home. I'll be good to go. I'll recover at home, and that's it. I did not ask him if he would suggest a surgery to a family member. That is the one thing I didn't ask, but the guy seemed pretty confident enough to give me the right answers. So, and give me the answer that I was looking for. And it seems like his experience, while minimal of 12 to 20 a year, it seems like the experience and the success rate is just extremely high for anyone that he does it for. So I'm actually glad I'm going through with this now, just because I know it's needed, and I think it's just going to get me on the right track and back to some form of normalcy. Because I'm going to be honest with you, I'm just missing too much because of all this. I'm missing time with my family. I mean, I couldn't even go to my father's house for Easter because of how I felt when I was driving. That's how bad it was. I can't even see my cousins and their children. This is close family of mine because of this. I can't see any other close family. They live a little bit further away, because of this. Thankfully, I work from home, but what happens if I can't work from home one day? That could also be a potential problem for me as well. And then I have to start driving into an office. I can't drive far because of this. So my life has really got affected. And the goal for me is to get my life back on track, get my quality of life back to what it used to be. Maybe not as crazy, slow it down a little bit, because that's what my goal was after ACDF. And it slowed down a little bit. Quality of life started improving over time. That's for certain. I've done a couple things here and there. But get the rest of my quality of life back because of the other problem that's going on. And I think that's just kind of where I'm going. I already have plans in my head about, this has been going on at least that I know of 7 years now, probably even longer than this, probably 8 years now. So my plan in my head is to try to relive those 7 or 8 years of things that I struggled through and had a hard time with once I know that this makes me feel 100% better. And I'm hoping that's the answer because in my head it is. We'll see. Anyway, that's it. If anyone has any questions about my artificial disc replacement surgery going on, please let me know. I will put out a video out there maybe the day of or day before my operation, just talk about it. I am actually not as nervous this time as I was last time. Last time I had too many worries in my head. This time I basically have a few, like for example, swallowing problems, voice problems, paralysis, and weakening, anything like that. But it's not as severe with the problem as it was last time. Last time I think it was because it was my first surgery that I ever had in my entire life, and I didn't know what to expect, and I expected to walk out of there basically feeling like a zombie and not feeling right. But this time, I'm okay. So anyway, if you have any questions, leave in the comments sections. Reach out to me. Reach out to me on YouTube, on wherever I'm posting this. And wish me luck. I'll update you the day before surgery. I'll update you 3 days after the surgery, tell you how I'm doing. And I'll continue my updates and tell you how I'm doing at that. I'll update you 1 year after ACDF. I'll update you, which will probably be about 3 months ADR too. So at that point, May, June, July, August. So yeah, that'll probably be right. So 12 months. So it will be a 12-month update on my ACDF plus a 3-month update on my artificial disc replacement. So I'll tell you how I'm doing. And yeah, questions, comments, leave them there, and wish me luck. I wish anyone else luck too that goes through this, because it's not fun to go through, but this is part of life and this is how it goes. So everyone, I hope you guys had a good one, and that should do it. Take care, everyone.
You think you know me.